Hi, welcome to Sage Health TV. I'm Dr. Angela Yeagley. Today I want to talk about the top 3 herbal medicines that support your health during this time and that have been found to be significantly anti-inflammatory and antiviral. Very important during this time of the new COVID-19 virus. So the first one is quercetin. It is ever present in foods. It is the part of the food that is colorful, and so when we want to increase quercetin, you do more. It's more called plant flavonoids, and so that would be like the recommended is 7 to 10 servings of vegetables per day, or you can also supplement, which makes it a little bit easier, maybe doing a combination of food and supplement. But what the important things here, what we found is that it actually inhibits or stops viral replication. So all of these, what we're looking at, they inhibit particular things that actually, even though they haven't been studied at this point to treat COVID-19, have been studied on many other types of viruses that are very similar. And so what we're hoping, the medical community is hoping, the functional medicine and integrative medicine community, that we can extrapolate and say, these herbs, these plants have been found to do these particular actions, and can we cross over and help your body? So we know there's an effect. We know there's a reduction in inflammation, a reduction in viral attachment. But again, we can't say specifically that this will directly treat COVID-19. But certainly, based on the research, tons and tons of research can absolutely be helpful. So so back to the quercetin. So not only it inhibits the viral replication, but also modulates means to kind of bring down and equalize inflammation. And then also, we're not using it for viruses in this way, but it also has a very strong antihistamine effect. So great for allergies, especially during this time. And most people worry a little bit like, oh, I have allergy symptoms. Am I sick? Maybe I have a virus. And now there's antibody testing that you can get that can be helpful to help you understand if you've had exposure to the virus. But again, if you tend towards allergies, this is a great one for you too. So the dose, if you'd like to do a supplement, is 1,000 milligrams twice daily. Or again, maybe doing half of that if you're really pushing your vegetables. The second one is green tea, and also the extract, the EGCG. And so this is a part of green tea that tends to have antiviral and anti-inflammatory activity. So the way that it works, it actually will inhibit the attachment of viruses and then also downregulates inflammation. The dose on this is actually 4 cups per day, which is a lot, I know, or 225 milligrams per day. Or again, you can do half and half, or just the capsules if you're not a big green tea fan. But this particular green tea has been studied for a long time on the effect of HPV viruses, other cold and flu viruses to be effective. So the third one is probably the powerhouse out of all 3 of these, and that's curcumin or turmeric. So we've known for a long time the potential for turmeric to be amazing at reducing inflammation. There was a great study that looked at pain and inflammation that found that for people taking 2,000 milligrams a day, it equaled 600 milligrams of ibuprofen. So, but in this particular situation, the recommended dose is about the same. However, the interesting thing is that we know that turmeric reduces inflammation on several of the inflammatory markers that are associated with COVID-19, as well as reduces incidence of what we call the cytokine storm. You've probably heard of that, and that's where a virus coming into your body, really your body just goes nuts and tries to kill it and creates a bunch of chemicals that are inflammatory. And this is really where, some harm has come in our bodies with COVID-19, is that it produces such a huge inflammatory reaction in some people that it actually ends up hurting the body. So turmeric has been found to inhibit several of these and reduce several of these inflammatory markers markers while increasing other inflammatory markers that are beneficial and not been found to be associated with a cytokine storm. So that's really cool, and this is really a great ally for us. So then also the last thing is just also modulating or decreasing the viral attachment and replication of the virus. So not only do we have the inflammatory action, we also are reducing actual viral activity. So again, the dose is 1,000 milligrams twice a day, best away from food to get that inflammatory action, as opposed to with food, it digests your food. And you can also do one of my favorites if you're actually trying to eat it, is doing something called golden milk, and Pinterest has a ton of great recipes on this to check out. So anyhow, those are the top three: quercetin, green tea, and turmeric. If you have any questions, please feel free to reach out. We know this is a hard time for people. We know people are struggling, and we are here for you to support you, to support your health. So please reach out to us if anything is needed. Okay, take care, be safe, and stay well.